Hey everyone, this lesson is on what foods to avoid if you have gastroesophageal reflux disease or GERD or acid reflux. So first off, what is GERD? So gastroesophageal reflux disease is a condition involving lower esophageal sphincter, LES, weakness, and inappropriate opening, leading to reflux of gastric contents into the esophagus. So if we look at this image here, this is the stomach, and this right here is the lower esophageal sphincter or LES. And what it's supposed to do is it's supposed to remain closed after you eat. So gastric contents, which are very acidic, do not go into the esophagus. But in this condition, there is weakness in the LES, which means that it opens inappropriately. And this leads to gastric contents entering into the esophagus, essentially leading to burning of the esophageal mucosa. So there's a couple reasons why this happens. Lower esophageal sphincter weakness is one of them, and then delayed gastric emptying, where food sits in the stomach for a long time. This can increase the risk for food and gastric contents leaving the stomach and entering into the esophagus. So that's another way. So what is commonly found in this condition is burning chest pain. So that's the heartburn. Oftentimes symptoms are worse with recumbency, which means that they are worse when lying down flat. And then the symptoms improve with sitting up. But the topic of this lesson is that certain dietary selections can worsen symptoms of gastroesophageal reflux disease. They can worsen acid reflux because certain diets, certain dietary selections can increase lower esophageal sphincter relaxation and or delay gastric emptying. So they can cause these mechanisms we talked about before to get worse and lead to worsening of symptoms. So what are some of these foods and beverages to avoid? So most of the foods and beverages we're going to talk about in this lesson come from this article entitled Risk Factors for Gastroesophageal Reflux Disease, the Role of Diet. So the first group of foods we're going to talk about, which are best to avoid if you have GERD, are the acidic or citrus fruits. So acidic fruits can exacerbate symptoms of GERD and cause increased acid reflux. So what are some examples of citrus fruits? So some of these include oranges, limes, and lemons, so very acidic. So an alternative to eating citrus fruits is eating non-citrus fruits. Consumption of non-citrus fruits may be better for patients with GERD. So if you're going to choose between a fruit to eat, it's best to try to consume non-citrus fruits. What are some examples? Some of these include apples, melons, and pears. So again, it's best to avoid or reduce consumption of acidic or citrus fruits. So it would be better to eat non-citrus fruits, and some of these examples include apples, melons, and pears. Another category of foods and beverages to avoid include those that contain caffeine. So caffeine can worsen symptoms of acid reflux by causing relaxation of the lower esophageal sphincter. So we talked about that is one of the reasons why we see symptoms of GERD occurring, because of relaxation or weakness of the lower esophageal sphincter. Well, caffeine can actually increase relaxation of that sphincter. So that's why caffeine can worsen symptoms of acid reflux. So examples where we're going to find caffeine include caffeinated coffee, tea, soft drinks, and energy drinks. And you can see caffeine in other things as well. We're going to talk about that in the moment here. And one of those is chocolate. So both milk and dark chocolates both contain caffeine and theobromine. So we mentioned that before. Caffeine causes relaxation of the lower esophageal sphincter, increasing acid reflux. Now, cocoa also increases serotonin levels within the gastrointestinal system. So it causes release of serotonin from gastrointestinal mucosal cells. And the serotonin surge is also known to cause LES relaxation as well. So cocoa contains tryptophan and serotonin, so it actually contains serotonin, but can also induce the release of serotonin from cells in your gastrointestinal system, which all lead to increased relaxation of the lower esophageal sphincter. So again, caffeine, best to avoid or reduce consumption because it causes relaxation of the lower esophageal sphincter. And then also avoiding chocolate because chocolate contains caffeine as well. And then cocoa itself can increase levels of serotonin, which is also known to cause relaxation of the lower esophageal sphincter. Another category of foods that it's best to reduce or avoid eating are spicy foods. So spicy foods contain capsaicin. That is what causes them to be spicy. So a lot of times you're going to see capsaicin in things like red chili peppers. And capsaicin slows gastric processing. It leads to delayed gastric emptying. We mentioned this before, that one of the mechanisms why we see acid reflux occurring is because of delayed gastric emptying. So capsaicin itself will lead to delayed gastric emptying. So some examples of foods that contain capsaicin, as we mentioned before, include red chili peppers and hot sauces that are often based on red chili peppers, and then some other peppers as well. Another category of foods that's best to reduce or avoid if you have GERD include fried foods. So fried foods increase symptoms of acid reflux due to delayed gastric emptying. Gastric contents are not released as quickly from the stomach when we eat fried foods, like spicy foods, so this increases the risk of gastric contents entering into the esophagus. So again, spicy foods best to avoid because they have capsaicin, which delays gastric emptying, and then fried foods also delay gastric emptying, both increasing the risk of gastric contents entering into the esophagus and causing acid reflux. Another category of foods that is best to reduce or avoid if you have GERD include high-fat foods. So again, the reason is the same. Fatty foods exacerbate symptoms of GERD by delaying gastric emptying. So these foods are more difficult to digest, so they are left in the stomach longer than other types of foods. So because of that delayed gastric emptying, they sit in the stomach and they increase the likelihood of those gastric contents entering into the esophagus, causing acid reflux. Examples of high-fat foods include fast food and some cheeses. And then another category includes processed snacks and foods. So processed foods often have high-fat content, so same reason as why it's best to avoid high-fat foods. This high-fat content leads to delayed gastric emptying. And then examples include potato chips, bacon, and ham. So again, high-fat foods and processed snacks and foods, which also have high-fat content, best to avoid because they delay gastric emptying, increasing the likelihood of gastric contents entering into the esophagus, causing acid reflux or worsening symptoms of GERD. We can also see tomatoes being a cause of worsening GERD symptoms or worsening acid reflux. So tomatoes are very acidic. They contain both citric acid and malic acid. And because of this, it worsens acid reflux. So consuming tomatoes themselves, but it's also important to think about other things as well, like tomato-based sauce and pizza. Pizza contains both tomato-based sauce and cheese, which we have talked about before, both worsen symptoms of acid reflux. So pizza is best to avoid due to this reason. Onions are also another food that can worsen symptoms of GERD, especially raw onions. So consuming raw onions can induce heartburn through its ability to relax the lower esophageal sphincter. So onions, again, best to avoid consuming, especially raw onions. So again, tomatoes, best to avoid because they're very acidic. So you want to think about avoiding things like pizza. And then onions, especially raw onions, can worsen heartburn, worsen acid reflux because they can relax the lower esophageal sphincter. And another reason why onions are best to avoid is because they contain fermentable fiber, which can cause belching that often worsens acid reflux. So the belching leads to opening of the lower esophageal sphincter, allowing gastric contents to enter into the esophagus as well. Now, something else that can worsen symptoms of GERD includes mint. So consumption of mint actually leads to worsened acid reflux symptoms because it actually itself irritates the esophagus. So some examples include peppermint, spearmint, peppermint tea, and even toothpastes that contain mint as well. So these can all increase acid reflux symptoms because they irritate the esophagus. Another thing we can see worsening GERD symptoms includes high consumption of salt, especially when you're adding salt to food. So when you add salt to food, this is associated with exacerbated GERD symptoms, although this could be more correlated with other types of foods like fried foods and high-fat foods. So it might not be the salt itself, but it could just be the association of eating or consuming high salt because that is also associated with fried foods and other types of foods. So it may not be the salt itself, but it could be a correlation with other types of food consumption. So again, consuming mint causes irritation of the esophagus, and then salt, especially eating added salt, is associated with worsened GERD symptoms, although this could be correlated with consumption of other types of foods. Now let's talk about some beverages to avoid with GERD. We talked about caffeinated beverages, but what are some other beverages that can worsen acid reflux? These include alcohol, so alcoholic beverages. So consuming alcoholic beverages can worsen symptoms of GERD and can lead to damage of gastric and esophageal mucosa. Examples include beer, wine, cocktails, and other beverages. And then carbonated beverages can worsen symptoms of GERD as well. So the reason is because carbonated beverages can cause stomach to become distended, so it can lead to increased pressure within the stomach, leading to pressure on the lower esophageal sphincter, which can lead it to becoming open. It can open inappropriately. And there can also be belching as well. This can also open the lower esophageal sphincter. So some examples of carbonated beverages include sodas, soft drinks, beer, and some wines. So as you can see, some of these beverages, like beer and some wines, have a double effect in that they are carbonated, which means that they can cause gastric distension, putting pressure on the lower esophageal sphincter to open inappropriately, leading to increased acid reflux. And the alcohol in these beverages can also lead to damage of gastric and esophageal mucosa. So it's best to try to avoid some of these alcoholic beverages if you have GERD. So again, alcohol consumption worsens GERD because alcohol can lead to damage of gastric and esophageal mucosa. And it's best to avoid carbonated beverages because carbonated beverages can put pressure on the lower esophageal sphincter through gastric distension, leading to inappropriate opening of the lower esophageal sphincter and increased acid reflux symptoms. So if you want to learn more about other foods and beverages to avoid if you have irritable bowel syndrome, please check out my lesson on that topic. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. Thanks so much for watching, and I hope to see you next time.